specific steps do hospitals typically have in place to prevent wrong patient surgery, and where do those systems fail?
Sure, that's a great question. It's interesting, actually. All across the country, the hospitals follow these same steps. It's called a universal protocol because it's universal across the country. What those steps are is first, when the patient first comes in, the surgical team will perform what's called the preoperative verification process. This is where they ask you to tell them your name, your date of birth, and then they'll cross-reference your medical record number. A lot of times when you're in for a procedure, you'll have a bracelet on. That bracelet might scan, or they can check the number. Then they repeat these steps multiple times before the procedure actually begins, up until right before the procedure, they do what's called a timeout, and everyone stops. And everyone on the surgical team is part of the timeout. And again, verify the patient's name, the person's date of birth, and their medical record number to ensure that they have the right patient on the table in front of them. The way this breaks down in a wrong patient surgery can be miscommunications between the team, or even just rushed or sloppiness among the team members, or it can happen at handoffs if the patient's being brought from another part of the hospital and being handed off, or if they're handing off in between shifts, or a lot of times when we see communications break down and patients being misidentified. The other thing is, if these steps, even though they're universal, if people are rushing or being sloppy, can skip these steps, or um, only do one of the timeouts or preoperative verifications instead of making sure that you have the right patient at every step along the way.